Well, welcome to the Bedford Police Department to our press conference regarding our diversion assistance program. I'd like to introduce to you our Honorable Mayor of the City of New Bedford, John Mitchell.
Thanks, Chief. Thanks, everybody, for coming today. So, we're here today to talk about a serious issue affecting our city's youth and our city generally, and what the city is doing about it. Gus is shooing you toward the microphone, Denise. Just make us look so much better. That's what it is. In our effort to at once make our city a safer place, but also to provide our kids in the city the opportunity to live, to thrive as adults, we need to address issues like substance abuse and mental health conditions right where they start. We have found that over the last several years, about 70% of the the children who are in the juvenile justice system have some mental health issue. And so we're here today to talk about a program that will enable us to address those issues head on and at an early stage, so that, again, those students who go through the program don't pose a risk to the community, and we can do everything that we can to put them in a position to get on track and lead healthy, happy lives as adults and contribute to our community. So this is really what we're announcing today. I'm going to leave the details to the chief, but in essence, we're starting a pretrial diversion program for at-risk juveniles who have emotional issues. And this is an idea that is worked in other places, but what we're trying to do again is approach the problem at a very granular level. That means engaging kids one-on-one, right where they are, and there's no substitute for doing that. And so we're working with the likes of North Star Learning Center, headed up by our good friend Maria Rosario, and from North Star today we have both Jimmy Owens and Melissa Costa to talk specifically about the program. But it's a way, again, of community engagement, of youth engagement, that it addresses our criminal justice problems at their root, but just as importantly, is an opportunity maker. We want our kids, whatever their backgrounds, whatever the traumas, whatever the pitfalls they've encountered in their lives, to be able to overcome those and get on track. This is not something that city government can do alone. This is something, again, that we need strong partnerships for, and so I want to thank certainly North Star for their efforts. I want to thank the Island Foundation. You'll hear from Denise Porcher, Executive Director, in a moment about their terrific support for this, and frankly so many other initiatives in the city over the years. It really runs the gamut of things. But look, we mean business when we talk about how we want to do right by the kids in our city, and it's not just about what happens in the classroom. It's what happens outside the classroom that is equally, if not more, important. The program targets youth 11 to 24 years old who have behavioral health and substance abuse disorder, who've committed minor offenses, and divert them away from the criminal justice system at a point where they're not posing a major risk to the community, and where they are in terms of their development, at a point where they can be helped meaningfully. This is the kind of support that every kid in our city deserves, and we don't want anybody to fall through the cracks, and that New Bedford is a city with a big heart that lives up to its reputation. So with all that, I want to thank the chief for his efforts, and the deputy chief for his efforts in getting this off the ground, and the kind of partnership that we have here, which is multifaceted and in which I have great confidence. So, Chief, let me ask you to thank you again, but also ask you to come on up and just say a few words on behalf of the department. Thanks.
Thank you, Thank you, Mayor. Just to reiterate a couple of points that the Mayor brought up, about 70% that we know, 70% of the youth that are involved with a juvenile justice system are suffering from a diagnosable mental health disorder. Another quarter are suffering from emotional issues. So knowing that, generally a lot of times the juvenile system does a pretty good job, but these individuals don't always get a look at the systemic causes of their ill behaviors. In terms of trying to, as another piece or tool in our tool set to prevent crime and divert crime, is to really identify these kids and get them the services that they need to get them on a different pathway. And that's the whole idea, to create to reduce our crime rate and create a community that's much more healthier. This idea came up sometime last year. I was having a discussion with Mr. Owens and Maria Rosario. Somehow we would love to have a clinician here, just didn't have the funding. They loved it. A few months later, speaking with Denise Porcher from the Island Foundation, I agree with the Mayor. She makes us all look better, and she makes things better, and you'll see why, because she supplied us with the funding for this program. So we go from a great idea to a reality because of those of her decision to fund the program. But in any event, the whole idea of this program, the Diversion Assisted Program, is to identify these kids who are suffering to no cause of their own from a mental health disorder or through emotional distress because sometimes of maltreatment, which leads them to cause these ill behaviors. We know by putting kids into the system all the time or in jail isn't the answer. There are some individuals that need to be in jail because they're so violent and they're creating such a safety issue for us. But for the most part, I think we get a bigger bang for our buck if we invest in these kids and get them the assistance that they need and divert them from the system, which is a very costly system in and of itself. And sometimes we'll even re-victimize the kids because they're not getting the services that they need. What's driving them to cause these behaviors is not being addressed. And that's what we hope to do here. And the way it's going to work with Melissa Costa, who's already started, is she's going to have the ability, and our officers in the field are going to have the ability to call upon her whether she's on that night or not. She can come out on call when they have someone that is displaying some psychiatric symptoms, some mental health, emotional issues, or substance abuse. She can come out, she can do a quick evaluation, decide if they need to go into emergency care, into the crisis center. She can put a hold on them. She can identify services that are lacking or gap in services, services not even being had at the time, and then have some follow-up with the child. So we're very optimistic that this program is going to have the successful impact for our city in terms of creating a healthier city and reducing the crime rate and giving the youth in our city a better chance in success, not only in school, but in society. So without going on, again, I would like to thank Maria Rosario, the Executive Director from North Star Learning Center, Jimmy Owens, Melissa Costa, who works there, and of course Denise Porcher from the Island Foundation. Without her and her commitment, the commitment of the Island Foundation, this would not be a reality. It would still be a talking piece in our conference room and in offices here and there. And of course, Mayor Mitchell, who's always been so supportive of the police department and some of our unorthodox methods that we're looking at in terms of reducing crime and making this a better city, from this program, from cameras, enhancing our camera program, our lead program that we're looking into do. The mayor's been extremely supportive, and without that kind of support, we can't get things done. And I think the mayor mentioned as well, our community is an incredible community. When you see folks coming together so quickly, willing and able to put more than just lip service to work for us, money, personal resources, support from City Hall, I think that shows this entire region what New Bedford's all about. So thank you very much, and without further ado, I'd like to introduce to you Mr. Jimmy Owens, the Director of Clinical Services of North Star Learning Centers. Thank you.
Again, I'm going to reiterate what much of my colleagues have stated, is that we're going to give thanks to the Island Foundation for their tremendous support and collaboration with all of this work that has been going on, the Chief, and I'll be remiss not to also thank our Executive Director, Maria Rosario, who unfortunately couldn't be here today. She is overseeing the distribution of the many donated items that were right here in this parking lot, this police department parking lot, that has gone overseas over to Puerto Rico. So she couldn't be here today because of that, and I just want to make sure I'd be remiss not to mention her efforts in making this come to fruition. The Diversion Assistance Program was designed, as you already heard, for the 11 to 24-year-old bracket, particularly looking at that population as being a targeted population because of what they do present at that particular age. 11-year-olds, the first time you start noticing some of the mental health issues and challenges that they have is usually when they go that entry level into middle schools, and that's when you start seeing those issues become a little bit more prevalent. You look at young adulthood, between 18 and 24-year-olds, where you can see the early onset of certain mental health illnesses that have that impact at that age, is why you want to also look at that particular end of the spectrum for the population. So this is a wonderful opportunity to be able to stop this population from seeing the deep end of the criminal justice system and making an impact there to make that work. So one of the outcomes and one of the goals of this is to be able to give them access, equitable access to the community resources that will help combat the problems of mental illness and possible substance abuse. So this works because everybody here has made the effort and put in a willingness to kind of make this work. So I just want to be able to say that, but it also works when you have a trained, specialized person doing this work as well that's going to be interacting with the police department, with the public, with the residents, with the issues front hand when they're actually happening. And that's why we turn to and actually contract and hire Ms. Melissa Costa to be able to be that licensed independent clinical social worker to make this work with the police officers and with the community. So I would like to be able to, I don't know, I'm introducing Melissa now, or should I introduce Denise now? But I'm going to...
It's Denise.
Denise, okay, so we're going to have Denise come up from the Island Foundation to be able to share a few words. Thank you. Come on, switch with you.
Yes. Hi, my name is Denise Porcher, and I'm the Executive Director of the Island Foundation. The Island Foundation is really pleased to make a grant for this youth diversion program, and we really trust that the partners involved will be able to help stem the tide of mass incarceration. Over the past year, the Island Foundation has made over $100,000 in grants for programs to help foster the relationships between police and youth, and we really feel programs like this are really needed in the community. So I really would like to thank the mayor, the chief, and the staff over at North Star Learning Centers for truly making this happen. And recently, a board member at the Island Foundation said to me during a discussion about mass incarceration, she said, "Denise, these are people, and they should not be thrown away." So thank you all for your efforts to make this happen.
Sure, I'll just introduce real quickly Melissa Costa, the Diversion Clinician from North Star Learning Center.
So I want to thank the City of New Bedford, Mayor Mitchell, and the Mayor's Office, as well as the New Bedford Police Department, Island Foundation for funding this opportunity, and North Star Learning Center for agreeing to contract with me as the identified diversion clinician. While there are different types of diversion programs being utilized throughout the Commonwealth, here in New Bedford, we have decided to implement the co-responding model. So what that means is that I will be paired up with different officers throughout the city going out on ride-alongs. And this helps to build a trusting and mutually respectful relationship with me and the officers. The officers need to be able to trust me, and I need to be able to trust them. So that way when I make, I describe it to the officers as I'm a tool on their belt. Just like as they have their gun, their taser, their handcuffs, whatever, I'm a tool for them. So if they feel that they need, if they're not sure about something, call me, or I'll be, I'll already be out there with them responding on call. This way they will know that, and the youth will be receiving the appropriate and needed treatment. We both want, officers and social workers all want, I'm sorry. Okay. We both want to help people, and co-responding allows us to bring our respective strengths and skills to each intervention. I look forward to serving the individuals in the community and assisting the officers by providing an alternative to arrest. Thank you.
So again, I just want to thank everybody for all their hard work, and this is a very promising program. And as I think I expressed to Stella Ribeiro on the way in, who's been very supportive of the program, this should be low-hanging fruit. This is a real area of need, and it's also a place where if we do it the right way, in the long term, we can really be doing right by an awful lot of kids in our community and make our community safer at once. So it's just, it's, as Jimmy said, as well as Denise, this is money well invested in our community. So I'll open it up to questions.
So is all the money funded this coming from the grant from the Allen Foundation, or is there any state grants coming in, or any,
Sure, Jim?
Currently, that's the status of the program, and it's all coming from the Island Foundation at this point. And we'll be looking at other streams as well down the line.
And next question for Melissa. I know you mentioned that you'll be doing ride-alongs with the officers. Is that going to be something you'll be doing, 6 months down the line, once everything's kind of in routine, or is that going to be just a starting point for you and the officers?
So initially, it will be a starting point, and my hope and goal is that that will continue to be the way of the program, is just being out there. If I'm out there, then I'm available to be on call, to be able to respond. It's about building like I said, it's about building the relationship with the officers. They need to know who I am. They need to know the program, be able to trust, that I'm making decisions that are going to keep them safe, as well as the community member safe. So it really is about that.
How much is the grant for? 10,000.
Okay. And is it 1 year?
1 year initially, yes.
And what type of offenses or what kinds of behavior will you be looking at, Melissa, to identify youth?
So we're looking at more of the nonviolent crimes. We're looking at the discretionary crimes, disorderly conducts, disturbing the peace, disruptions in the home, those calls that we get where, mom has a 10-year-old who's out of control, a 12-year-old that's out of control. They just kind of want some stability within the home. So being able to kind of go out and do those kind of responses.
Is this program reaching into already incarcerated juveniles as well, once they're already in the,
So this is a diversion program, so this one is looking at it, it's called where the point of contact is for them, so this one is looking at the grounds, like Mayor Mitchell has said, stated earlier, we're looking at the, that first point of contact.
Does that diversion area leak over to if anybody who's been has a prior history of being in the juvenile system?
If they come back in contact with us at a later point, yeah.
Okay.
And Melissa, what will you do? You identify, and then what will you do? You make a referral?
So I'll be, because I do have the independent license as a clinical social worker, I am able to do a psychiatric evaluation on the scene if necessary, and at that point make that diversion call. Does this person meet level of care criteria to go inpatient? Then we need to seek emergency services at that point. Is this someone that could benefit, if we're talking youth, 11 to 17-year-olds, then do they qualify for a CBAT level of care? 18 to 24, do they qualify for a community crisis stabilization unit level of care? So I'm able to make those evaluations as well as make those recommendations and make sure that they're getting the treatment that they need. Or even with the youth, if they qualify for CASEL, or some kind of, or MIR, the other youth recovery programs.
So they'll be referred to counseling or inpatient treatment, or?
I can do the initial assessment and then send them to the emergency services with my recommendation.
Is this voluntary or involuntary? In other words, if you refer them to inpatient treatment, is the old word final? If they said no?
So if I find that they meet criteria for inpatient level of care, then Section 12 is issued and they're held involuntarily for further evaluation and processing.
Chief, have you spoken with the courts about this and what their feelings are?
No, we've not had any real dialogue about it. This is kind of new to our region, but there are other communities that are doing it, and this would be pre them entering into the court system. Right. They still may be involved with some court charges, even though Melissa will be conducting that evaluation, but it'll be at the front end, not at the back end of it. But that's a dialogue that we certainly will have with them, because we have great partnerships with just about every organization in the city.
And where else has this program been used?
I believe Quincy has a similar program. It's not quite the same, I don't think, but similar. Cambridge may have one as well.
All right, thanks, guys, appreciate it.